Welcome back to STL Live. I'm Sarah Thompson, and my guest is Dr. Joan Davis of the St. Louis Dental Center. Thank you again for being here.
Thank you for having me.
I want to kind of emphasize, and I know we touched upon this in the first segment, but really emphasize it here in the second segment, that kind of an extension of A.T. Still University is really reaching underserved communities, and that applies obviously to the dental school as well. Is that correct?
That's right. Even the placement of the facility, it's in the heart of St. Louis. We're there to care for those in need. And the students get a great deal of training and preparation to be compassionate, to listen, to really learn what the patient needs, and then to provide the care that they need.
Mm-hmm. And you mentioned earlier too, if people are hearing this, when we talk about underserved communities, there might be a possibility that someone is not insured or underinsured
That's
when
right.
it comes to dental health, but that is something that people can reach out and inquire about.
Absolutely. There is reduced dental care fees available. Also for the veterans, we have programs that might help them get dentures, free dentures. I think the best bet is to just come in, see what their needs are, and then we can plan it out step by step as they're able to do it.
Okay. Well, I want to kind of get into an area you have as a researcher too that is important. I think sometimes overlooked a bit more and more because smoking at one point in the 80s and 90s, there's a lot of PSAs about it. We talked a lot about tobacco. A little bit less and less, but still it's very quite important and the effect that it has. Tell me a bit about some of the studies that are coming out in between the correlation of obviously tobacco, smoking, and oral health.
A lot of people think because smoking is going down that there are not as many people affected, but there are still over 440,000 people a year that die from smoking-related disease. So even though the number of people smoking is going down, we have a long way to go. And I have to say for Missouri, because of the limited laws that they have to prevent workers from being exposed to smoke, secondhand smoke, Missouri gets a grade of F from the American Lung Association for their smoke-free efforts. And so there's a long way to go. A totally smoke-free Missouri, here we come, I hope. Just because of the many, many people who are exposed to the smoke themselves as they breathe in, but then their children, anybody in their home, in their car, and also their pets. People don't think of the toxic smoke when they breathe in and they breathe out. That smoke has over 7,000 chemicals, arsenic, formaldehyde, 60 different carcinogens in that tobacco smoke. So if you're breathing in a pack a day, then you're breathing in 200 puffs of toxic smoke. It starves the body of oxygen, so that causes the immune system to go down. You can't fight infection. And so that's where the connection comes in with oral health. There are lots and lots of bacteria in the mouth. And if the body can't fight the bacteria in the mouth, then you get gum disease, then your teeth get loose, then your teeth fall out, then you can't eat. It's hard to talk. It's just not a good situation.
Yeah, and it leads to so many other problems. And I mean, is oral health, would it be solely directly correlated to actually smoking, or when you mention secondhand, thirdhand smoke, is that usually more for the lungs, or does that actually, can secondhand, thirdhand smoke really move into upper respiratory?
Certainly secondhand smoke can. Children have a lot more ear infections. Their asthma is aggravated. They have their immune system doesn't work real well because they're getting that secondhand, those 7,000 chemicals, every time they breathe in the smoke. So we really encourage parents to smoke outside, but then they need to wash their hands so they don't have the tar and the toxins on their hands when they touch their babies. And at the dental school, we absolutely help people quit smoking. It's possible to quit. There's tobacco quit lines. The Missouri has a tobacco quit line, but certainly as a part of the comprehensive whole health care at the dental school, we're committed to working with people to help quit smoking, help them with their diabetes control, blood pressure control, We refer out if we find something that's a concern, but we're there for them.
That's wonderful. Such great information. Thank you so much. If you want to reach out to them, again, you're talking about we've not just been talking about dental care, but whole body care and health, and obviously that connection to smoking. Go ahead and reach out to the St. Louis Dental Center. It's stldentalcenter.org, or you can call 314-883-2700 to learn more or to make an appointment. Well, there's more STL Live right after this. Please stay with us.